I'm Karen Klassen, and I'm here every Monday at 7 p.m. Mountain Time to give you an opportunity to connect and support each other. It's so important for all of us to know that we are not alone on this journey, okay? And these calls are really to inspire you to get involved in what we're all co-creating here. We're really being called right now to step up, to feel the fear and do it anyway. We're being called to take part, no matter how big or small, in the transformation of our country. It's no longer up to the government or any institutions. It is up to we, the people. As we each find a way to serve through the 9 pillars, or by being in our plan councils, in our provincial plan councils. So it's really time to just listen to your inner leader, your higher self, and the call to take inspired action. Reach out and let others know what you can do and what your skills are. We're all open to learning. We are all learning ourselves. This is new for everyone. And so if there is a part of you that is angry in the system that we're in, and I bet there's a lot of you that are, right, frustrated with what's happening, then I really recommend that you join the weekly think tanks and use that emotional energy to help create the change. We need your voice, your creativity, and together, right? It's we can only ever do this together. We have the power then to change our future. We have the power to change our future through what we choose to think, our thoughts, right, and the actions that we take. Today, I'm very excited. We have an amazing woman here, Ahnalee, who is going to give us a presentation on German New Medicine. Then we're going to have a Q&A, and at the end, I'm going to be offering a 10-minute meditation, which is focused on shifting our energy from that survival energy to a thriving energy. If we do not feel safe, it's very difficult to change, transform, or to see the good, right? To see that there's something powerful that's really happening that's for our highest good. So if we don't trust ourselves or the environment, then we are in survival mode, and then there's no energy. We feel depleted, and there's no energy for that true transformation or unfoldment to infinite possibilities. Now, if you have yet to sign up on the Life First Canada website, I highly recommend you do. I know there's quite a few people that, give out the link to their friends, and that is awesome. For you to receive all the updates and to be connected to our tribe across Canada, I do recommend that you sign up on our lifefirstcanada.ca website. Dwayne, if you can put in the chat, that would be awesome. So again, we need your voice, your skills, your support, your knowledge in creating this new earth. It is up to us. And as you know, there have been dark controllers, that do not want us here. And as we step into our power and we remember who we truly are, they then no longer have control. So we're again creating the changes through the 9 pillars and our plan councils so that we reclaim our sovereign rights. Before we get into our presentation on German New Medicine, I have an exercise for you to do. It's only like 1 minute. Okay, so I would recommend if you have a paper and pen, it's called the appreciation exercise, because I'm experiencing deaths of friends, of people that I know, whether they were acquaintance or a friend. And for instance, a woman that I met last year, she would come to, we would have these freedom potlucks, and I didn't really know her well, but I met her, lovely woman, and she was fighting for freedom. I don't really know the circumstances, but I know that all her family, double shots, and last week she was just brought into the hospital and they put her on ventilators, and now she's on life support. So I do believe we're going to be seeing more of this. My internet is letting me know it's unstable. So I'm just going to pause for a second. So we are going to be experiencing more of this, more deaths in the future. And we need to prepare ourselves mentally, emotionally, and spiritually. So right now, I just want to give you an exercise, and I think it's really important. It's called the appreciation exercise. So number one is I want you to write down all the names of your family or friends that you need to or want to acknowledge. Even if you are angry with them or upset with them or you don't believe in them, just write down all their names. That's the first step. So it can be friends and family. So step two is I want you to write down 3 things that you appreciate about that one person. So you start with the first person you wrote down, write their name down. So you write 3 things down that you appreciate about them. 1, 2, 3. It might take you 10 minutes to think about it. It might take you a day, I'm not too sure. But you want to really find it in your heart. What is it that I appreciate about this person? And then number 3 is you're going to call that person and you're going to let them know how much they mean to you. We may think this is easy. I know there, as a coach for the past 20 years, I've had clients who have never even shown appreciation or said any words of acknowledgement to their mother or their father, sister or brother, their husband or wife. So we really need to acknowledge that people in our life right now, we cannot wait because we don't know what tomorrow is going to bring. And I think it's just really, really important for all of us to acknowledge and show appreciation in word. You just never know how much time we have, right? Okay, so as you know, there's a beautiful energy that flows through us that gives you strength and power. So let's just take a minute here just to breathe in that life force energy. Breathing out. And one more. Breathing in slowly and deeply. Absolutely, John. Yesterday is gone. Thank you, Francois. Okay, getting right to our topic. Ahnalee, I actually just met her when I interviewed Kristen from the Canadian Frontline Nurses, and she shared a little bit about German New Medicine, and I was intrigued because I believe in what she's talking about. So I'm just going to share her bio. She received her Bachelor of Home Economics degree from UBC. Then she spent 2 years teaching in Ghana, West Africa with Kuso. After returning to Vancouver, she studied to qualify as a teacher, then taught mostly foods and nutrition for the Vancouver School Board while raising 2 children. And after obtaining her MA in education, Ahnalee worked 10 years as vice principal before retiring in 2000. She was then inspired by the amazing work of Dr. Hammer and the fabulous teachings of Caroline Markolin and the study of German New Medicine. Since 2011, she spent time teaching small private groups in Vancouver, encouraging others to study the details of this beautiful new paradigm of medicine and how we can take control of our own health. Welcome, Ahnalee.
I really appreciate this opportunity. Speaking to groups online is a little unusual for me. I do like the personal contact, but it's really amazing to connect with people across Canada in this way. I did do a very simple PowerPoint, and I was hoping that you would allow me to share it.
Absolutely. The floor is yours.
And I always have to start with a disclaimer slide. Any information I give you is simply for information and education only. I am not a qualified medical professional, as you've heard, and anything you do as a result of anything you hear from me, it's your responsibility. That's really important that I say that. However I express things, it is not meant as medical advice. Sometimes I will tell people how I deal with things, but it's still not meant as medical advice. Okay, so what I am talking about today is the research of Dr. Reike Hammer, who spent his life from the 1980s until he died in 2017, devoted to this research. He has been forbidden from sharing the research with the rest of the world. He was forbidden from practicing it, and his medical license was taken away from him. He spent his life basically in Spain, away from people who were after him. And he eventually went to Norway, where they couldn't get him and extradite him, because he did have to spend 2 years in prison. So Dr. Hammer did all this research, and he did it, of course, in German. So it's not accessible to those of us who don't speak German. However, it has been translated by Caroline Markolin, who studied with Dr. Hammer several years in person. And then she made a commitment in 2011 to return to Austria from Canada. And she developed the Learning GNM website. And the Learning GNM website has all the information that you need to know about GNM, although it is much more complex than listening to somebody who can simplify the information the way I do. The reason that Dr. Hammer started this work is that his son was shot and died. He succumbed to the injuries of that shooting. And he developed, soon after his son's death, a type of testicular cancer. And he intuitively knew that that cancer and his son's death were related. So he started doing this research. And in the end, what he discovered is that every so-called disease, even his testicular cancer, is part of a meaningful natural program that developed during evolution, both of animals and humans, to help us through some kind of emotional distress or danger, actually. Okay, so every so-called disease is initiated by what we call a conflict shock, or in honor of the son Dirk, we call it a DHS, a Dirk-Hammer syndrome. We in German New Medicine do talk about SPCs and DHSs and things like that. We have this really strange language, but conflict shock works, and that's pretty good English. What Dr. Hammer discovered was that every so-called disease is initiated by a conflict shock, a distressing situation that hits your subconscious in a subjective way. And you actually have no control over it because it hits you subconsciously. So you have this moment of fear or anguish of some sort that starts a biological program running in your body. And Dr. Hammer discovered this by looking at, I'll go to this one, looking at 3 areas. First of all, remember this was 1980 and CT scans were new, so he used CT scans and he looks at the person's brain, and he discovered that in the brain there are indications of conflict activity and indications of healing. And he learned to read those. But being a doctor, before his medical license was taken away, he also had access to patients' medical records. So he could look at the things that were going on in the body. So he knew what kind of cancer they'd been diagnosed or what other condition they'd been diagnosed with. But the other thing that he did that was so brilliant was he talked with the patients to find out what was going on in the psyche. and what sort of emotionally distressful experiences they had had in their lives. And he put all this together on an enormous chart, and that's out of date now, but he has an enormous chart that connects the psyche, the organ, and the brain. So a conflict shock hits the psyche. It is immediately transferred to a specific area of the brain that controls a very specific organ, and a biological program starts running. So the biological program that runs depends on what part of the brain controls the biological program. So in an old brain controlled program, immediately cells will begin to proliferate. Cells will begin to multiply. And you think, why on earth would that happen? Well, it happens because you need more of something in your body. So for example, if you are experiencing a death-right conflict, it goes to the brainstem, and the brainstem sends a message to the lung alveoli, and the lung alveoli begin to proliferate. That allows the body to process oxygen more quickly and gives the person more energy for resolving the conflict. If the old brain, if the conflict shock is something like, I have no money. I have no money at all. I have no money to buy food. Then the person experiences a starvation conflict. A starvation conflict is also controlled from the old brain, and immediately cells begin proliferating in the liver, so that the liver will produce more bile, so the bile will be able to break down every tiny little morsel of food they are able to take in, because this is about, I'm worried about starving. So there are some biological programs that involve cell proliferation. And of course, the cell proliferation, a group of cells, is seen by the medical system, if they're allowed to look for them, as tumors. And if the cells are multiplying rapidly, those tumors could be called cancerous. If the biological program is running from the new brain, instead of having cell proliferation, when the person is stressed, they have cell loss. So a good example of this would be the bronchial tubes. Cells are lost in the lining of the bronchial tubes so that air passes to the lungs more quickly, so that it can be processed more quickly, so the person will have more oomph in order to get that conflict shock resolved. If the shock is a territorial anger, then it goes to the new brain that controls, say, the bile ducts, and the bile ducts start losing cells, and that widens the bile ducts, so the bile that is produced in the liver can go more quickly into the digestive system and help with digesting that anger. So that's what happens when a person is stressed with conflict activity. Okay, I wish my program would work properly, but it won't.
You're doing great.
Oh, I'm grateful that you're so understanding. Okay, so you get more of something, or you get something faster to help you resolve the conflict. And if you work on it, you can usually resolve the conflict in one of two ways. You can have a practical solution, which could be getting out of the environment where you had the territorial anger, or getting out of the environment where you had the fear. So moving away might be a resolution, or just avoiding that area, or avoiding a specific person that makes you angry. If you cannot avoid or change the situation in a practical way, you always can control your attitude. You can come to terms with what happened to you, totally accept what happened to you. And even in the case of a death-right conflict, you might say, This is God's will. Whatever is happening, and I am okay with it. So those of us who practice German New Medicine in our lives are very good at changing our attitude about any kind of situation so that we go into healing very, very quickly when we recognize that we have been in a stressful situation. Because we know the sooner we resolve the conflict, the lighter our symptoms are going to be. And in German New Medicine, we normally start with the symptoms. There are some times where symptoms are conflict active. That's only in about 20% of the cases. Most of the symptoms we experience are healing symptoms. So those are the ones I'm going to stick with today. When you go into healing is when you feel awful. When you are conflict active, you are full of energy. When you go into healing, you are not full of energy. You will probably need to rest. An animal knows that intuitively. After running away from a predator, an animal will go and rest under a tree. Humans resist the temptation to rest, but that's exactly what we should do. If it is an old brain controlled program that the person is running, then those cells that were produced in the conflict active phase need to be broken down. They are broken down by microbes. Fungus, by TB mycobacteria, and sometimes even by bacteria. And that is so different from what is taught in the conventional system. Because you have these microbes at work in your body, they think the microbes are causing a disease. In fact, the microbes are there to assist you with the healing. In the old brain controlled programs, that's getting rid of the cells that you no longer need. You don't need more digestive enzymes. You don't need more lung alveoli. You don't need more cells in the liver because now you've got enough money to buy enough food. So if the program is an old brain controlled program, you have to decompose those cells and then you have to get rid of them. So in the case of the lung alveoli, when those cells are broken down, you cough them up. And it can be a very unpleasant experience because you might be coughing up a lot of guck that's smelly and very unpleasant. And it will contain microbes. Yes, it will contain microbes. So the old brain control programs heal with a lot of cell decomposition. New brain control programs didn't have any extra cells, they lost cells. So when you go into healing, you have to refill and replenish the cells that were lost. And that can be assisted by microbes, but only bacteria, not fungi, not TB microbes, only bacteria. And the bacteria don't have to be there. The healing will happen whether you have the microbes or not. The cells are refilled and replenished, you've got new cells. But all healing happens in a fluid environment. And so those new cells are in fluid. And if a conventional system person looks at your lungs in some magical way through an MRI or whatever they do using, they see these clusters of cells in fluid and they call it a tumor or a cancer. So in the case of the bronchia, which you lost cells in the conflict active phase. In the healing phase, you put down new cells. And in the healing phase, you will experience the symptoms of bronchitis. If it's in the bronchia, you experience coughing, bronchitis. If at the same time you are isolated from family and friends, or have some fear of a disease that involves difficulty breathing and coughing, then you run another biological program as well. That biological program shuts down, closes down some of the kidney collecting tubules, causing the body to retain more fluid. So the healing area, we're talking about the bronchia, has healing fluid in it already. And fluid, when the kidney collecting tubules close down, and now you've got lots of fluid in your lungs, and that condition is called pneumonia. And we do know that that can be fatal. So if a person has bronchitis, the most critical thing is to be surrounded by loved ones, which has been difficult in these times, and to be in no fear, which is also extremely difficult in these times. So I think a lot of people who have claimed to experience C19 have, in fact, experienced either bronchitis or pneumonia from fear and fear plus isolation. Let's see what my other slides say. Okay, so there could be bacteria when the when the bronchi are healing. There could be bacteria there that they will detect, and that's okay. They are not causing harm. They are allowing you to produce cells more readily. Another new brain controlled program could run in the bile ducts of the liver when the person has a territorial anger or an identity conflict. And when those cells refill and replenish, that can actually be very dangerous because there's fluid there. And if the fluid plus the new cells accumulate, it is possible for the pancreatic ducts to almost close down. But I think it's critical for everybody to know that microbes play an absolutely wonderful role in the healing. They live in harmony. Why do we have 10 times as many microbes as body cells if they don't live in harmony with us? They play a vital role in healing, and they do not cause disease. And if I pass my microbes to you, if you can't use them at that moment in a biological program, you just store them up for later use. They don't make you sick right away. You only use the microbes when you're in healing. That's the GNM perspective. And the GNM perspective on viruses is, if they actually exist, they will be there to assist the body. And the existence of viruses, at least as long as Dr. Hummer was alive, was never substantiated in any scientific way. So those of us in GNM really discard the fact that there might be viruses. There are certainly, in our terms, no viruses that cause disease.
I love that you said that.
I love saying it.
Yes.
I love saying it. The next thing I need to say is something about the concept of metastasis. It is, in GNM terms, an academic fiction. Every new cancer in the body is from a new conflict shock. In our terms, metastasis does not exist. But what can happen is you go to a doctor and you get diagnosed with a cancer. That puts you in fear of dying, a death right conflict. What happens? The lung alveoli cells start multiplying. What does the conventional system do? They send you for a lung X-ray, and they find those cells that are multiplying, and they call them a cancer. If you are diagnosed with a cancer, you can also go into a self-devaluation, feeling not very good about yourself. And that can cause a program running in the lymph system. And what do? They find swollen lymph nodes. They say you have cancer of the lymph, and they remove them. or they remove them before the biological program can even run there in order to prevent a cancer there. But those new cancers in the lungs and in the lymph system are all from new conflicts. A death-threat conflict goes to the alveoli. A self-devaluation, not feeling good about yourself, that can go to the lymph system. It can also go other places, but it can go to the lymphatic system. Okay, let's see what else I put here. Okay, so to review, every so-called disease runs in two phases, providing there's a resolution of the conflict. In the conflict active phase, you are alive, you are feeling very well, you are usually full of energy, with a couple of exceptions. You are full of energy and you're getting things done, and you're supposed to use that energy for resolving the conflict. Other symptoms will probably not be noticeable. It is when you go into healing that you feel awful. That's when you go to the doctor. That's when they find things happening, especially things happening involving microbes, and they start giving you a diagnosis, which may start you running extra biological programs. I'm really whipping through this, aren't I? Oh, I had some other examples that I wanted to share with you, and I wrote them down. Just a moment. I'm definitely not accustomed to working from a script. Examples I have. If a woman detects a lump in her breast, it can mean one of two, well, it can mean a couple of things, but basically two things. One, she is at that time worried about somebody in her nest, worried about a family member, worried about a child, worried about somebody we call a partner. And here I should say, if it's a breast cancer, the side tells you who it's about. So I'm a right-handed woman. If I ran a cancer on my left breast, it would be about my children or my mother. If I ran a breast cancer on my right side, that would be about someone other than mother and child. And this is true for many other programs as well as breast. So a breast lump can mean you're worried about someone in your nest, or it can mean you have resolved a separation conflict. So you've separated from someone you wanted to separate from, or you have come to terms with a separation where somebody has been taken away from you and you've gone into healing. So there is a breast cancer that is conflict active, and there is a different breast cancer that is healing. So we would look at the lump or talk about the lump, and we would start asking questions to help the person resolve the conflict, because only she can identify what it's about. So another example, if a person has a rash, we might need to look at the side of the body it's on to find out whether it's mother or child, or if it's a partner. But what we do know is that a rash indicates they've healed, something related to having separated or wanting to separate, or even fear of separation. If an individual has a pain in a knee, and that pain in the knee is not from an injury, then we know that that individual has been devaluing themselves as far as some sort of physical performance, like I'm not running as fast as I should, I'm not going up the stairs as well as I should, or I should be doing something better. And it's a physical performance thing that goes to the knees. Another example is if a person is vomiting, we say, if we're vomiting, we say, oh, great, we've resolved an indigestible morsel conflict, and when this is over, I'm going to be feeling better. So we experience a symptom and we don't say, oh no, we're sick. We say, isn't that wonderful? We're in healing. And then we accept the healing symptoms and we don't worry about it. So vomiting often means you have resolved an indigestible morsel conflict. Something in your life was hard to accept, to digest, or to absorb. Something like that. There can be other conflicts that go to the digestive system. So indigestion itself could be from a territorial anger. It could be from an identity conflict, but those are too complex for me to go into detail about. So this is my wrapping up. GNM is a complete scientific system. He stressed it was science. He always stressed the science, and it's based on 5 biological laws, and they explain the cause, the initiation, the development, and the natural healing of every so-called disease. And the 5 biological laws are here. Every so-called disease is initiated by an unexpected conflict shock, which hits the subconscious in a subjective way. And every so-called disease runs in 2 phases, provided there's a resolution of a conflict. And the 3rd biological law is about the tumors. Old brain-controlled tumors are conflict active. New brain-controlled tumors are healing tumors. And the 4th biological law, so many people have a hard time with, is about the microbes, which play a role in the healing process. They do not cause disease. And the 5th biological law is that every so-called disease is part of a meaningful biological program that was designed in our evolution to help us through a time of crisis or danger. And sometimes it involves not the existence of the individual, but about protecting the pack. So sometimes these biological programs don't make sense unless you think about the pack. So this is how we live in GNM. We trust our bodies completely. And Dr. Alvin de Leon in Bonn says, at this point in time, your body is doing exactly what your body is supposed to do at this point in time. So every moment in my body is just perfect. All the messages that it's getting, it's responding to. I just need to understand what is happening. And if action is needed to resolve a conflict or to help me deal with a difficult healing, then I need to take that action. So everything I've said is available on learninggnm.com. And if anybody needs to get in touch with me, my first name @telus.net. And I hope I haven't taken too long. And I am certainly open to answering questions. I love questions. I love to be interrupted normally when I'm teaching to take questions.
Thank you
So
so much.
should I stop the share now?
Sure. Yeah, definitely.
Okay.
Perfect.
Stop the share.
And yes, if anyone has a question, we'll start out with Sherry.
Thank you, Ahnalee. That was fantastic. What I'd love to know is the German New Medicine take on the debate around germ theory versus terrain theory.
Well, definitely it would be terrain theory more than germ theory, but terrain theory does not encompass the understanding of the psyche, brain, or organ correlation. Yeah.
Thank you.
Great question, Sherry. Alan.
We had just a little debate the other day. A friend of mine, he's got a Ph.D. in teaching, and he basically said, I'm carrying COVID germs, and basically what I'm doing is I'm causing all these other mutations and all this sort of thing. I was wondering what your take on that, this drama that we're playing out for the last 2 years, which is probably going to play out for another 3 till everybody's got no jobs, no food, no nothing, right?
Well, I am definitely on the timeline that says that Life Force Global is in the right direction, and the orders that they've just put together are going to help us through this time of crisis. My responsibility is to take care of my health. Your responsibility is to take care of your health. in the way that you choose. And nobody should be coerced into anything. I am so far on the other side of the fence from anybody who believes in that a vaccine is going to do any good. The virus, the so-called virus that they say is being transmitted around has never even been isolated. So how could they possibly make a vaccine to treat it?
Exactly.
So can you go into isolation a little bit, what that kind of means?
When people are not ready to hear, they're not ready to hear. And there are people who are much better able to talk about. My personal perspective is that a disease-causing microbe called a virus does not exist.
Okay. So what are people dying of in the hospital, let's say, like it's a bad pneumonia thing? I mean, what's your take on what's going on?
My take on the pneumonia is that the person experiences some kind of fear that goes to the bronchial tubes, and they go into healing, and there's some water in the bronchia already from the healing.
Right.
And then they go into another biological program at the same time from fear and panic or isolation and abandonment, which causes the body to retain more water. And that extra water also goes to the bronchia, so the person has fluid on their lungs. And pneumonia is always dangerous. The person needs to be kept calm, surrounded by family, so that they reduce the water retention.
Okay.
A hospital is a very bad place to be at that time.
Oh God, yeah.
Thank you, Ellen.
All right.
Great questions.
Okay, good.
Thank you so much, Ahnnalee. This was really interesting. More things to research.
Yes.
My question is, on several of your slides, you talk about old brain and new brain. What are you referring to when you're talking about old brain and new brain?
Okay, the brainstem and cerebellum are old brain. So any biological program controlled from the brainstem causes cell proliferation in the conflict active phase. So that would be the lung alveoli, most of the gut, and what we call the pharynx, which is this area up here. So a lot of things to do with the mouth. The cerebellum is part of the old brain, and the underskin, the skin where you develop a melanoma, is controlled from the old brain. So a melanoma develops in the conflict active phase of an attack conflict, basically. The other things that are controlled from the old brain, the pleura, which surrounds the lungs, which can suffer an attack conflict, the peritoneum around the gut, which can also suffer an attack conflict, and the pericardium around the lungs, which can suffer an attack conflict, particularly during surgery on the heart. The prostate, the uterus, the fallopian tubes, they are all controlled from the old brain, so they all have tumors in the conflict active phase. A couple of other bits, but that's going into too much detail, I think.
Okay.
New brain, you asked about new brain. So when we talk about new brain, we're talking about the cerebral medulla, which controls all of the skeleton, all of the striated muscles, the fat tissue, the lymphatic tissue, and all of the blood vessels except the blood vessels on the outside of the heart. And they respond usually to a self-devaluation conflict, something when you don't feel good about yourself or about that part of your body. So that's the medulla. The medulla also controls the ovaries and the testicles and the spleen and the kidney, part of the kidney parenchyma. Did I say the myocardium? So those are new brain controlled organs. And then there's the cerebral cortex, which controls, well, the milk ducts, the outer layer of the skin where you experience separation, and so many others. So the cerebral medulla and the cerebral cortex are the ones that I refer to as new brain, where there is cell loss in the conflict active phase and refilling and replenishing of cells in the healing phase. So it's in the healing phase of a new brain control program that you might get diagnosed with a cancer.
Thank you.
You're welcome.
Thank you so much, Dorothy. Great question. And this is so phenomenal. I know everyone here is enjoying this, Ahnalee, so thank you so much for being here. Tanis.
Yes, good evening. I was wondering, just for the simple fact, because they, like Cabal, whoever you want to call them, has been programming us for, I would say, centuries, to have a certain like shame in all directions, like in all parts of our lives, that there's always shame attached to most of the things that they try to, like, you know, with our bodies or our careers or whatever, like we're not good enough in something. So what organ does shame have this?
Okay, there is no conflict for shame, but shame would be related to a self-devaluation conflict.
Okay.
So a person who is really ashamed of the way they look, their body, might start running a program in the fat and develop lumps of fat, actually, which doesn't help with the shame, does it?
Yeah.
a person who feels unworthy can start running a program in the muscles, so that the muscles begin to break down, lose cells, and they become weaker. And in fact, that is what causes the development of bone cancer. An absolutely intense self-devaluation conflict goes to the bones and to the bone marrow.
Interesting.
Yeah, so it's very important to always feel good about yourself. So anybody who's telling you that they're unworthy, you get rid of that and you go into yourself and you say, I am perfect just the way I am.
As we all are.
Exactly.
I just have another question when it comes to speaking with your peers who do, well, just other, say, nurses or doctors. How do they respond to this theory or this German medical? Yeah.
Your best bet is to keep your mouth shut.
Oh, okay.
Unless they ask for it.
Very good. Okay.
If they ask for it, if somebody asks for it, if somebody asks what I teach, I often say, do you really want to know? And if they say yes, I'll give them a little bit. If they want more, I'll give them more. But you may notice I have a tooth missing here. It's because I cannot bite back when I want to bite back. Yeah. So my best answer to that is keep your mouth shut, but try to be good with that because you don't want to go into your teeth. Okay. If they ask, then yes, give it to them little bits at a time, but do not do what I did and overwhelm your children with it, because I've had, I won't say a falling out. My children and I are on different planets, and I describe it that way. So our relationship is challenging.
I think a lot of us experience that, yes.
Yes.
Especially the ones on this call.
I mean. And for me, it's even a bigger divide because it involves a totally different way of looking at the body and how it works.
Thank you so much. I appreciate all of what you do. Thank you.
Well, I'm grateful that you're willing to listen. Anybody that's willing to listen to me, I'm grateful for.
This is amazing. And this is incredible. Thank you, Tanis. Barbara, we're at Marion.
Hello.
Hello.
Thank you for this presentation. It's so interesting. I'm wondering, how do parasites fit into this paradigm?
Parasites, my understanding, and we don't talk about them much, hardly ever. my understanding is that parasites are in your body to do a job. If there's something that needs to be cleaned up, there are going to be parasites there. In German New Medicine, we don't fight nature. Now, we don't also know much about parasites. They don't teach us much about parasites. So if you have parasites and you want to get rid of them, then go to somebody who can help you do that. It depends whether they're uncomfortable or not. Maybe they're working in your body and you don't even know. But I would never go looking for them. I feel fabulous. Why do I go looking for something to be wrong?
I have some friends who are suffering from Lyme's disease, which I'm hearing is associated with a parasite. Is
Lyme disease is a combination of symptoms that we in German New Medicine call a soup diagnosis, which means that there are many different biological programs running, producing many different symptoms. And each of those biological programs has a different biological conflict shock attached to it. It's not going to be easy because somebody who's running that kind of a program has many things to look at and many issues to resolve.
Thank you.
Thank you, Marianne. And we have Brian.
Just wanted to comment to more or less get your opinion, which some characteristics, behaviors might justify exactly what you're talking about. I was thinking about a hypochondriac, and they're more or less their personality is they just worry about everything all the time anyways.
Okay.
So it is reflective of basically of what you are saying. And another aspect of what you're talking about too was like a placebo. If you believe it's going to work, it will work.
Yep.
If you have faith, like you said, turn it over to God, have faith, and you will get better. And I just wanted to comment on that. I just wanted to end with one other comment was, this is something I've been saying for a long time. If I want to be sick, I'll go to the hospital. With that, I yield.
One of the people on this call, Irene, has a 99-year-old mother whose philosophy is that she should stay away from doctors and hospitals. Yeah. One of my friends on this call.
That's great advice.
I need to mention hypochondriac. Dr. Hammer's discoveries went much further. And what happens is that when there is a conflict on the right side of the brain in one area and a conflict on the left side of the brain in the same basic brain area, it changes the person's behavior. So a hypochondriac, if I'm remembering correctly, a hypochondriac is worried about their health all the time, right? So that is a conflict in the temporal lobe, and they want to suffer. They want to suffer. So they are on the depressive side of an aggressive constellation. They're on the depressive side of an aggressive constellation. The person they want to hurt is themselves. If they're on the manic side of an aggressive constellation, they want to hurt others. And there are specific conflict shocks that put a person into an aggressive constellation. One is a territorial anger, and the other is an identity conflict. Who am I? Where do I belong?
And there's a lot happening on the planet right now with those two.
Yes, exactly. There's a lot happening on the planet right now.
Mhm. Thank you for that.
Okay. Oh, did I finish with everything that he was talking about?
I talked about hypochondriac.
Just let me tell you a couple of others because
Placebo.
Oh, placebo. You were right with placebo. You described that really well. Let me tell you about a couple of other things, just in case you have a parent, and I one of the elders who has some difficulty with memory loss. If you experience a separation on the right side, and for me, it would be related to a partner, and on your left side, and for me, related to a child, if you're suffering separation conflict on both sides, then your memory is really, really bad. Your short-term memory is really, really bad. So imagine how many people are suffering separation conflicts right now. The other one that is good to know in this day is abandonment. If you're suffering fear and panic, isolation, and abandonment, and it goes to the area that controls the kidney collecting tubules on both sides, you can be totally disoriented. Totally disoriented. This is the kind of person, if it's really intense, that walks around in a circle. These are the people that get told they have Alzheimer's. And what has this world been doing to the elderly for the last 18 months? Isolation and abandonment, separation conflicts. More Alzheimer's coming up for kids, lack of focus, ADD. Lack of focus is separation on each side. They've been separated from their friends, maybe separated from a family member that didn't do whatever they were supposed to do. Yeah, could be more ADD.
As you were talking about ADD, it seems that I've seen some experiences, children with divorced parents.
Oh, yes.
They have the ADD, and that's attention deficit disorder, which
Yes.
is exactly what you were talking about.
Yeah. Well, separation from mother, separation from father. And they're with father, they're separated from mother. They're with father, with mother, separated from father. And, you know, they can go in and out of it. It can be very difficult.
Thank you, Brian. Great questions.
Hey there.
Hi.
So I just had an interesting conversation with my medical doctor Wednesday on behalf of one of my friends who I didn't think she would do it, but he wanted me to see if I could find him a doctor that would take, I think he said $100,000 to shoot the shot in the garbage can. Now, I knew that my doctor wouldn't, but she's very supportive and believes and thinks the same way that I do. So I just wanted to say a couple of things that she said is, number one, she said, there are doctors that know, and that there is a US Canadian Doctors Alliance right now. I don't know if you've heard of it, but it's CanadianCovidCareAlliance.org, which that one has everything on it from like telling the truth. It had an open letter to the unvaccinated because someone wrote a note, or an open letter to the vaccinated because someone wrote a nasty letter to an open letter to the unvaccinated. They've got a lot of support things there, a lot about the virus, a lot of natural ways of healing. And then she also mentioned FlemingMethod.com, which is healing naturally from everything from cancer onward down. But one of the things that she said that I thought was really interesting is she said that sharing on social media, which is what I was doing, which is bad. She said it's better to go one-on-one and share with your little groups of pockets of people that will listen to you, that think the same way, and that will at least look into it, because especially on the Canadian COVID care one, there's a lot of factual stuff, and it's doctors, and it has that Peter McCullough on it, who is one of the guys that is in support of what we're talking about. So after I talked to her, basically, she wouldn't give me the person that will shoot it in the garbage for money, but she did give a lot of help, and it made me feel like at least there's some other people out there that are looking out for us as well. And with that, I hold.
I think that there are some doctors who understand German medicine. Caroline Markolin believes that some doctors understand it. But because of the way that they would have been looked at if they talked about it, they don't talk about it because they would be ridiculed and they would have their licenses taken away if they did not practice what they're told to practice. So yeah, I am now personally avoiding a lot of social media, and I'm avoiding watching a lot of stuff about the C-19 and the jab, because I know what I know, I don't need any more information. So for me to spend my time watching Kimberly and Tank and those people is much better served. And this weekend, I went onto the spreadsheet and tried to help out with the spreadsheet. That was how my friends and I were spending our time this weekend. And we hope that we have been just of some service to you, to the group.
That's fantastic.
Yes, and thank you also, Ahnnalee. That was amazing, all that you taught us.
Well, I'm grateful you're willing to listen. I'm always grateful for
Yeah.
people who will listen. Because we need to spread the word. And once you know it, you cannot unknow it. My children would love for me to unknow this information. Doesn't happen. I totally trust my body. I absolutely live without fear of disease.
Yes, fantastic. Okay, we have 2 more questions. Barbara.
Hi, everyone. Ahnalee, that's just amazing information. When you were talking about hospitals, I call them the scariest place on earth. One thing I wanted to ask you about was inflammation and how that relates in German medicine. A lot of us, sorry.
Inflammation is part of the healing process.
So if you think it's from wheat,
No,
is
no.
that-
No, I went 20 years gluten-free and then learned German new medicine. Now I eat anything I want.
Okay, because I want to eat anything I want too, but I always find that wheat makes me have issues. But is that
Okay.
because I'm making myself have issues?
No. What happened in your subconscious. And it happened while you were eating wheat. So what I would have to know is what your symptom is. And what you would have to discover is when the shock occurred. And at that time, you were eating something that had wheat in it. So those of us in GNM can convince our psyches that wheat is no longer a danger to us. Whatever happened is ancient history. It's no longer relevant in my life. Wheat is no danger to me. Thank you for all the warnings you've given me all these years. I don't need them anymore. Please stop these warnings. I'm all good. And wheat is no danger to me. That sort of story is what we tell ourselves.
So you don't have to actually find that trigger way back when,
Well,
because God only knows what
it might be a good idea. If gluten is the trigger to a symptom, you know that gluten was in the environment at the moment that you suffered a conflict shock. The type of conflict shock you will know when you look at your symptoms. So if it's a rash, you know it was about separation.
What about with allergies?
What is the symptom of the allergy?
Like runny nose, scratchy eyes?
Okay, the eyes and the nose are separate in GNM. So if it's a runny nose, you experienced a conflict that is a stink conflict. At the moment that you were eating something that contained wheat, you experienced a stink conflict. And now, every time you eat white wheat, your body is reminded of that stink conflict and puts you into the healing phase, which is the runny nose.
Okay.
And if you want to get in touch with me directly, you certainly may.
I'll do that. Thank you so much for offering.
I do not like to do it over email because we know that, well, I shouldn't put anything in writing, right? But I will have a conversation with you if you'd like.
Wonderful. Thank you so much. With that, I yield.
Great questions, Barbara. Thank you. Cheryl.
Hi, Ahnalee.
Hello.
My question was about how would German new medicine explain Parkinson's?
Okay, Parkinson's means that I think there were two people that were asking a question at the same time. So I'll go back to, I think it's Cheryl who didn't get her question out. Parkinson's means that the person is stuck in what we call the epileptoid crisis of the healing phase, of a feeling stuck conflict, a feeling trapped conflict, unable to move, tied down, unable to move ahead. So a person with Parkinson's, if they wanted to deal with it, would have to look at when their symptoms began and figure out how they felt stuck or trapped or tied down or unable to move or move ahead.
Okay, I'm just curious because when you said that, it just made me think, because this is more of an elderly condition. So
Not necessarily.
not necessarily. Okay.
I have a friend that I play pickleball with, and I see that he has already developed the shake,
Yeah.
particularly in his hand.
Mm-hmm.
And he doesn't talk about what I talk about, of course. And when I said, why don't you call me to talk about it? He didn't call me. That's okay. He is his own sovereign being. So my suspicion is that he is unable to hold on to somebody in his life, that somebody in his life has deserted him for some reason or other. And that happens a lot in this day and age.
Okay, thank you.
Thank you, Cheryl. Is it Leni? How do you pronounce your name?
Leni, yeah.
Beautiful. Welcome.
Thank you. I have a question. Hi, Ahnalee.
Hi.
I have had cracks in my heels since I was little, like really deep cracks, and they come and go sometimes, but they're there pretty much all the time, and they're really painful. And I'm just wondering what that's about.
I would ask myself, is there someone that I want to sort of rub out of my life with my heel?
So from when I was little or now, or?
Well, it would depend when the thing started.
Before I can remember.
It does make it more difficult. Both heels?
Yeah.
No, can't give you an answer right now.
Okay.
Sorry.
Thanks anyway. Okay.
Thank you, Leni. Okay, and Sherry.
I was just wondering about sleep apnea.
Sleep apnea is related to the myocardium and the myocardium. So it is like a repeated small myocardial event, the muscle of the heart. And the conflict associated with muscle of the heart is an overwhelmed conflict.
Okay, thank you.
Thank you. And we have one more question, Donna.
Hi, good evening. I am curious about factor V Leiden and severe anemia.
What was the first thing you said?
Factor V Leiden.
I don't know what that is.
Okay, thank you.
Severe anemia is a severe self-devaluation, not feeling worthy, not feeling good about yourself. And in conflict activity, you lose cells within the bone marrow, and the cells in the bone marrow are what produce the red blood cells. So you're producing less blood cells, less red blood cells, and that is called anemia.
Okay, thank you.
Great questions, everyone. Okay, so in summary, what my takeaway here is that I want to share with everyone is that all trauma in one's life, right, is in the psyche, and we must realize in order to change anything in our outer world, we must be willing to resolve the conflict within our own psyche. And I love that you said this is God's will, and I'm okay with it, whatever's happening in our life in the moment. It's so important for all of us to move through any unresolved issue in our life right now. I do believe that we're moving through a collective breakdown, moving through into a collective breakthrough right now. So I think everything that you're talking about, Ahnalee, is just so divinely perfect. And I think we all need to say to ourselves, this can be a mantra: viruses are my friend. And when Ahnalee is talking about relaxation, because a lot of us forget to rest. So when we are resting, I don't think that means watching television. It means actually allowing self to sit with self, to be with self, to sleep. And we need to reestablish in our own minds what relaxation is, because we've been programmed on the television and through movies that when we see people relaxing, they're grabbing a glass of alcohol, right? So it's taking the time for sacred self-care, which is really important. I do find that what you're saying too is that the dis-ease within our body is that dis-ease, how we're out of ease. We're not in ease with our worthiness. You mentioned unworthy quite a few times.
What we have to be at ease with is the difficult symptoms we experience in healing. That's the most important thing. And I have to add one more thing. Please, please, please do not do a lot of conflict resolution around old conflicts. Okay? Deal with the things that are new in your life as soon as you can, but don't go to those old ones, because some of them could cause healing that is hard to recover from.
Yes.
But that's such a terrible note to end on. Most of us, we just trust our bodies. We trust our bodies. We deal with things as they come up. We don't dig back into the past. We live in the moment, and we love the moment, and we love ourselves in the moment. How about that?
Excellent. Self-love. That's the journey that we're on.
Yes, exactly.
Thank you. Thank you so much for being who you are and sharing this incredible, phenomenal information. And I'm so glad that you spoke up on that call with Kristen, because I was very intrigued with what you had to say as well. So thank you so much for being here. And we're so glad that you're a part of Life Force Canada.
So am I.
Yay.
Yes, I appreciate the opportunity to be here. It was lovely to chat with you all. I'm feeling a lot more relaxed about it than I was at the beginning. Maybe I'll get used to this online stuff soon.
Yeah, this is great.
Yeah.
Okay, everyone, thank you so much for being here. We are going to now move into a 10-minute meditation. So if you need to go, I completely understand. Thank you. Have a great week. And for those who want to stay, you're welcome to join us in the meditation. And again, thank you, Ahnalee.
Bye, Karen. Good night, everyone.
Good night. And remember too, words of wisdom that she shared was, the next time you vomit, yay, I'm healing. That's what you say. Hey, yay, I'm healing.
That's exactly right.
I love that. Very good. Okay, so we're just going to close our eyes. So remember, I mentioned earlier that if we do not feel safe, it's very difficult to change or see the good, right? To see the good within yourself or to see the good out in the world. And if we don't trust our environment, we're going to stay in that survival mode, and that's that fear-based thinking. And again, there's no energy there for the healing, which is what we've been talking about this evening. If we fear our surroundings or we fear others, we continue to react, right, from that subconscious program. So right now, as I'm speaking to you, I just want you to breathe, focus on your breath. So you're going to slow down your breath. So we're moving our breath from the lungs. We're going to move down into the diaphragm. So you're going to be breathing in to the count of 5 and breathing out to the count of 5. And so again, as I mentioned, if we're in fear, we continue to react. We react to life, we react to the television, we react to what's happening. And these are subconscious programs of lack and limitation that were built up, right, in the mind control program. Thriving in life comes from an open heart, a relaxed mind, and a state of trust. And when there's a deep undercurrent, right, where you feel safe to be yourself, then you're in that space and place of accepting life for where you're at right now. And then in that acceptance, there is a powerful transformation that can begin to change the game of life that we're witnessing. So we're here to ascend the energy out of our contracted survival mode and into an openness. And after centuries of being in survival mode, we need to begin to practice, right, the unlocking of this program. To create a new reality, we need to create a new inner world, a higher energetic frequency. So I want you to repeat these words after me in your mind, just in your mind. Just let my voice become yours as it resonates through your being. Just allow these words to vibrate through every cell of your body. I am safe. Just keep focusing on your breath, slowing down. I am secure within myself. I am safe. I am safe to express myself. I am safe to express my thoughts and feelings. It is safe for me to live in this space and in this time. I am safe. I am free. I am sovereign. I'm opening myself up to feeling good about myself. I am free to feel happiness no matter what is going on out there in the world. I am free. I can be kind even when I'm frustrated. I am choosing to be compassionate even when I do not understand another. I'm free. I am free to heal. I am free to transform myself. I am free to grow. I am free to unfold the truth of who I am. I can relax now. I can breathe and let go and simply be. I am secure within myself. I am worthy of all good things. Keep focusing on your breath. I am grounded. I stand on solid ground and it is safe for me to be here. I chose to be born for this time now. I am safe no matter where I am. I am safe, therefore I can dream. It is safe for me to come out of the cave I've been hiding in. I am safe, therefore I can have a beautiful vision of the future. I am safe, therefore I can follow my heart. I am safe now in opening my heart. I am safe, therefore I can follow my intuition. Focusing on your breath. I trust myself. I trust myself to make good choices. I'm open to learning from every choice I make. I trust in the guidance of my higher self. And I now act upon my inner wisdom moving forward. I'm releasing all the negative beliefs I've been holding on to because they do not serve me. I am energetically held by the loving spirit of life. I'm choosing to love myself now, no matter what. I'm choosing to love my body now. So now we're just going to sit in silence for a few moments. Just keep focusing on your breath. And you can continue repeating those positive affirmations within your mind. Believing in the highest thoughts possible. On the count of 3, you can open your eyes. So 1, bring yourself back into the room. 2, bring yourself back into your body. And 3, open your eyes. Together we rise, everyone. Thank you so much for being here. Marianne, yes, I will be posting this in our YouTube channel.
Oh my God, I'm on YouTube.
Yeah.
Oh, dear.
Okay, everyone. And if you can continue with your meditation, I highly recommend you do. For all those of you in Alberta, I'll see you on the call tomorrow night. Thank you, everyone. Namaste.